Hey guys, welcome back to The Dent Life. My name is Komal and in this video I'm going to be trying to make a vlog.
Hey you, I saw you from the distance. Hey you, can we talk? Hey you, I think you're my subsistence. Hey you.
Okay guys, I'm all ready for work I guess. It is now 9:15 and I don't even know what's going on. Very exciting start to my first day actually.
Hey you, I think you're my subsistence.
To be sued.
So we've basically just finished the morning stuff. Everyone in London KSS that is part of the scheme that I'm in, or the region that I'm in, they're doing different things today because not everyone can be in one place at the same time. So today my day is about e-portfolios. This is the e-portfolio, basically everything we need to complete in September, and then as you go on, hopefully there's not as many things to do. We were told what to do in the presentation that we just had in the morning and we've been given 3 hours to do it. At the moment I've got a few more things to do, so I'm gonna just get on with that and then have some lunch and then come back and do the rest of the afternoon. I think it's just gonna be like question and answers. It's been a pretty slow day, but what else can you expect when you're working from home as a dentist? Like, it's not going to be very exciting, but it's got to be done, so that is fine. So far I have filled in my details, I have uploaded my photo, uploaded my contract, and now I'm on this section. So this section is called the pre-DFT clinical experience review, and it's basically just saying how many things I have done before I started DFT. So at university, what procedures have I done, how many have I done, do I have any comments? And I know this because I have it on my screen over here. This is just lots of numbers. This is from my dental school. In clinic, every time you do something, you record it. So you log into your profile and you write down, okay, today I did 1 examination and 1 filling. And so you write that down. It's like a little tick box thing and it tallies it up for you. So I've written down that I've done 57 exams, photography 14, child in pain 0, adult in pain 19, oral hygiene instruction, I've done 77 of that, so if anyone needs oral hygiene instruction. Yeah, so doing this has actually really jogged my memory and reminded me how much I needed to ask supervisors for help at dental school, and my educational supervisor is really nice, so I'm sure it won't be a problem if I ask her for help. So anyway, that is complete. I'm gonna have some lunch. So that was my first day of being a dentist. It wasn't what I ever imagined it would be. It was quite anticlimactic, quite boring. We were on Microsoft Teams, about 60 of us. There were lots of awkward silences. I was gonna make like my first day at work video, but obviously this isn't my first day at work, so when I do get to work then I'll possibly do that. But at the moment this is just my induction week, so if you find this video boring then try being in my shoes. A good start, man. Second day and I failed. I just feel like because I'm at home it's like not as motivating to get up really early. So it's day 2 of my induction week and today we have differential diagnosis. So yeah, I've got my smoothie, I got my notebook, and I've got my laptop ready. Cool. And I'll let you know if anything fun happens. We've just finished the first part of the morning and it was a really interesting morning. I learned quite a lot. It is break time and I have my coffee with me and we're due to be back in 2 minutes, so I just thought I would tell you guys about what I've learned about surgical sieve. Already knew about it, but it's really important to revisit these things because that's basically what our career is based on. And then dental sieve as well, which is a term that I don't usually use, but it was great to actually learn about what a dental sieve is and the concept of diagnosing using that. I think I have to go back now, but yeah, basically it was a good morning. The rest of it is actually going to be about triaging and how to diagnose over the phone, because that's really important now that we're in COVID times. We don't want everyone to come into practice, so it's really important to be able to actually diagnose things on the phone. So that's what I'm going to do, and I have to go now because everyone's back, so see you later. So this is actually a big problem with virtual learning. We're just waiting for some of the people to come back because they've been cut out because the internet's probably bad.
Do you want me to take over temporarily? Yeah, so you're sort of practice as well as a dentist.
This afternoon has been really useful. So whoever's teaching us, he is pretending to be the patient and then he's asking someone to be the dentist, and we're treating it like a remote consultation. Okay, let me tell you the main things I've learned. Tell the patient something looks like, so don't set it in stone when you're talking to them because you can't see them, it's never going to be 100% accurate. It looks like you have a swelling, it looks like this may be coming from a tooth, stuff like that. So you don't say it's coming from a tooth because it might not be. 111 now has urgent dental care hubs that basically the patient can go to, so they call 111 and then they're sent to the hub. There's about 40 to 60 in each borough. This is something I didn't know, so really interesting to find this out. And basically what I'm going to write in my e-portfolio is that one of my learning needs is that I need to know more about my area, so where I'm working for the year, where to refer patients, if I need to refer them, how to do it, things like that. So it's just things that I didn't even think about. I did learn that I need to go over just so much stuff because I have forgotten a lot more than I thought. I learnt how to easily write a referral, SBAR technique. S is situation, so you explain the situation that the patient's in. B is background, so you basically just give a little bit of history of the patient, age, medical history, things like that. Assessment, so what you did and what you actually found. And then recommendations, so that is what you think the treatment should be or could be. That's a pretty easy way to write a referral. I wish I knew this when I was doing my finals and things. It just would have helped because I think I had like a really long-winded way of doing it. So it's gonna be almost 3 o'clock. The day is going okay, it's going a bit slower than yesterday, but I think it's because I'm learning more and my brain is just absorbing more, so time is slowed down. I don't know. So that is the end of day 2. I have learnt so much today and I'm on my e-portfolio again and started to fill it out. So I'm going to be talking about the topics that I learnt about. What did I learn that was new to me? And then I need to write about how I applied this in practice. The things I learned today are really relevant to, for example, my clinic book that I made a video about. So I'm excited to transfer all of that into my DFT clinic book. There's a lot to do in terms of that. I need to kind of plan it out, see how my practice works as well. So I don't know when I'm going to do that, but hopefully it will be soon, maybe this weekend, I don't know. Let's just see. Let's just see. Hey guys, so it's day 3 of my first week as a dentist and today I'm actually going somewhere. So I'm wearing outside clothes and I'm got a little bit of makeup on. If you didn't notice, then just don't say anything. So what I'm doing today is, at the moment it's 9 o'clock, I'm doing a bit of admin and actually some revision for my MFDS, and then this afternoon I've got amalgam cavity prep, so I'm going to be driving to East Grinstead to do that, which is over an hour's drive away. I hope it doesn't take me super long, but you know what, I can't even complain because I really feel for the morning group. We got split into 2 groups and I luckily got afternoon, so yeah, just using this morning to do some work. So I'm just getting ready to leave for my study day and I'm packing a few things. I think I'm being really extra, so I'll just show you what I'm packing. So I've got my scrub top, my loops, so I'm literally gonna get to wear my loops for the first time in so long and I'm actually really excited. A mask as well. And I'm taking my famous clinical notebook, and it's got the amalgam stuff in it. I hope I'm not going to need it, but just in case, I do have it with me. And the most important thing I have is the teeth. So I've got some real life teeth that I got from my supervisor. These are the teeth that I'm taking with me. Some of them have like white bits on them, and that actually is calculus. It's bleached calculus. Come on, bye. No. So I've just reached East Grinstead. It took me just over an hour. It felt like much longer, so I'm really glad that I don't have to come here often. I'm an hour early because I thought I'd have lunch somewhere, but I don't think there's anything around, so I will see how that goes. I was a bit too early. So I'm at McDonald's and that is what I'm going to be eating in the car before I go in.
I'm wandering slowly that you are no more than a dream. Hey you, wanted. Hey you, we could be more. Hey you, honest. Yeah, it's true, you're all I want. You're all I want.
There's 24-minute congestion in 0.2.
One thing I learned is that people call bears by their number names. So basically at university we would call bears by the shape. So for example, pear-shaped bear, rugby ball shaped bear, needle bear, things like that. But then I've come here and they're like tungsten carbide 330. I think that was the bear I used, but I was like, oh crap, I don't know the names of these bears. I want to know when I go to work, am I going to be talking about it in the sense of shapes or in numbers? So I have to really quickly learn the bears, I think. So that's one thing that I basically took away from the lesson, apart from obviously the amalgam teaching, which was really helpful. But I feel like it was a revision session rather than learning anything, because obviously we've been doing amalgams since second year. Another thing I took away from the session is to learn what kind of materials my practice has. I don't actually know what they have, what will be available to me. So for example, things like what kind of amalgam or what kind of instruments do they have for me to do the prep with. And then I started thinking about things like impressions. So I already heard that loads of practices don't have, you know, certain types of impression materials, or don't have certain types of, they don't have things to mix with. The materials I'm going to have aren't going to be as good as what I had at dental school. So I'm just a bit like, nervous. Hopefully it'll be fine. And yes, I am still stuck in traffic. Someone is really not impressed with my outfit. Leo! He just doesn't like my boots. He's not happy with this fashion choice. So it's not over yet. I still have some revision to do for MFDS. So I've already had my dinner. and I'm gonna do revision probably till 9 o'clock, and then I will call it a day and get ready for bed, because even though I had a half day today, it really feels like it was a very, very long day, so I'm so ready for bed. One last thing I've forgotten to do, and I promised myself I would do it every single day, so I have to do it now, is my e-portfolio. So it's a bit later than I expected, but I am going to finish the e-portfolio off and then I'm done for the day. So it's the final day of my induction week, and today we're learning about the NHS, I think. So obviously I'm at home again. Yeah, it will be an interesting day, hopefully. I've got my smoothie over here in a pint glass, and I can actually see Yewande. You all know Yewande. I've literally had the longest Friday ever. The lunchtime that we had, I was driving around doing errands and I had to get back so quickly. Literally forgot to record anything I've learnt.